So my name is Avril Dowling. I'm the HR lead in the Pfizer Grange Castle site here in Dublin. We've about 2,500 colleagues on site. The majority of our activity is manufacturing based.
On site here in Pfizer Grange Castle, we have our connected health model. What that means in practicality is that the colleagues here on site have the fastest access to clinical settings and medical settings. Colleagues have access to the gym facilities, to different classes, fitness classes, screening programs, and the site itself is supported by our occupational health services. We connect all of this through the user-friendly portals, which engage colleagues in the services that are on site, and it provides rich data at the touch of a button to the site leadership team here.
We're looking at everything that we can do in order to improve everyone's lives on site here. But what we were motivated by is increasing our offerings in the wellbeing space. And our intention was to be as holistic as possible for everybody.
I'm the health promotion specialist on site in Grange Castle on behalf of Laya Healthcare. So I would work really closely with teams from people experience to environmental health and safety, and also work closely with the DE&I groups to design and deliver the wellbeing programme. The programme was brought in here in Grange Castle in 2022, and in a collaborative way it was built under the wellbeing pillars of mind, body and life. We pride ourselves on our on-site gym, which we find is really well utilised even throughout the night. We would run classes there ranging from Pilates, boxing classes, also nutrition supports, and they're free of charge for all colleagues. We're not trying to just focus on physical activity in the gym, we're also trying to ensure that there is something for everyone so that colleagues feel supported in all areas of their well-being.
So occupational health play a vital role in the kind of prevention but also education. So the early intervention is really key. The health connected services play a vital role for us in trying to get key services early, from a diagnosis to a treatment, so we can rehabilitate them early.
And the health screening programme that we've introduced then as well is phenomenal, particularly when individuals are detected with something that they didn't know that might have existed. It's really helping colleagues to help themselves, to stay healthy.
So when Pfizer first engaged us in this process, it was just after COVID. It started really with engaging with them on what their requirements were, what were their objectives, what were their global objectives, and then also connecting that with the services that we were able to provide.
The partnership was tremendous. In fact, we pushed timelines very aggressively, as we do.
It was a process that lasted 12 weeks from start to finish, but that took engagement with the wider team and a partnership approach that really stood us to the test of time.
Generally speaking, the response from colleagues is fantastic. All the services are being used, so the physiotherapy, the massage therapy, the financial one-to-ones, the nutritionist, they get booked out on a regular basis, So we are seeing active engagement. We have a lot of the infrastructure set up and it's quite embedded. What I'd like to see is that getting even stronger and deeper rooted into the organisation, to see more and more people enjoying different aspects of it. We benefit at the end of it all, but this is around really enabling our colleagues to have accessibility to health screening, to healthy lifestyle choices, and if they can do that with us, all the better.